I think that's an excellent question with relation to cost because, again, being cosmetic treatments, these are all privately paid. The difficulty, of course, is that's going to be physician dependent. It may be country, state dependent. There may be many factors affecting those costs. But in general terms, using treatments like Botox or purchasing a syringe of filler appear to come at a fairly reasonable costs in the hundreds of dollars. Many times they're very manageable for patients even when they're younger, in their late 20s, and can have very, very valuable effects on improving their appearance. However, at some stage, if one is considering having to repeat these treatments on multiple occasions, and assuming a patient has achieved a certain age and is starting to show other facial changes, where it looks like they're going to start requiring multiple syringes of filler or extensive amounts of product, the cost can be substantial. It's also important to remember that as we start to age and those other changes are happening, that's the point where we may want to consider the cost of what we're spending, let's say every 9 months, to maintain this look that we like, versus trying to consider other treatment modalities like fat grafting or surgical cosmetic procedures to try to establish a more, maintenance-free cosmetic effect that ultimately, despite the initial higher cost, typically ends up being cost-saving in time. But I do want to reiterate, those types of procedures aren't ideal for the younger patients who really, at a younger stage, require that ongoing maintenance with Botox and filler, as do many of the patients that still go through facelifts, however, often to a much lesser degree.